Hi everyone, welcome to Plastic Surgery Education. Today I'll try to address some of the common queries related to ingrown toenail. So what is an ingrown toenail? When the nail of the great toe of the foot tends to go in and impinge on the surrounding areas of the nail, it creates a lot of problems for the patient. So that is what is called as ingrown toenail. So what causes an ingrown toenail? Ingrown toenail can be caused by a variety of reasons. Some are preventable, some are not preventable. So the preventable ones are if you try to cut the nail too close to the nail fold, then what happens is the surrounding skin grows over it and it causes an ingrown toenail. Then wearing too tight shoes which causes crowding of the toes, that also is one of the important reasons for developing an ingrown toenail. Then there are certain non-modifiable reasons, like with increasing age, especially in diabetics, what happens is the distal phalanx, the terminal bone of the great toe tends to get narrowed with age. It is an aging phenomena. So what happens is the support of the nail, it reduces, and then since the support reduces, the nail tends to curve over it. So that is also one of the causes for ingrown toenail. So can it be prevented? To some extent, yes. If you are able to take care of the preventable causes, you can prevent it. But the age related changes cannot be prevented. You can take care and see to it that the clinical manifestations are minimal, your complaints are minimal. So what are the treatment options for ingrown toenail? In the beginning, if you don't have significant complaints, you can comfortably manage it at home. Soak your leg in warm water with some salt or with some soap, and once it is soaked, the nails tend to be a bit soft, and at that point of time you can manipulate it with maybe a cotton bud, or there are certain products which are available on Amazon which tend to give traction to the nail, and the inward turning part is you try and get it out. So I have not personally used, but some of the patients have suggested that it has worked really well. So you might want to give it a shot. So apart from the non-surgical treatment which you can do at home, if you start having significant complaints because of the ingrown toenail, which can be significant pain, throbbing pain, infection, pus developing in the nail bed, nail fold because of the ingrown toenail, then obviously it is the time you consult a plastic surgeon. So what do we recommend for ingrown toenails? If it is comfortably managed at home, obviously that is the treatment of choice if you have no complaints. But yes, if you have complaints, we might suggest that the part of the ingrown toenail along with the nail bed has to be excised. Now, is that procedure painful? It is done under local anesthesia. 2 to 3 injections are given surrounding your toe, and then that totally anesthetizes the toe region, and then we excise that part of the nail which is causing problems along with the underlying bed, so that the further growth of the nail is not hampered and it doesn't invert when it grows at a later date. So we do it under tourniquet. I mean, there is a tourniquet at the base of the great toe, because of which what happens is we are able to visualize the structures very appropriately. There is minimal bleeding, and since the structures are visualized appropriately, we are able to address the issue in a proper manner. And since it is under local anesthesia, there is hardly any pain. For the first 2-3 days, I would say there is some amount of minimal pain which is taken care of by painkillers, and after that most of the patients say that there is no pain. How much time do you take to recover after surgery for an ingrown toenail? On an average, I would say it takes around 3 to 4 weeks for the wound healing to be completed, and in some cases it might be a bit longer, but that is, I would say, the average time it takes for the wound to heal. After surgery, is it likely that the ingrown toenail might recur? Yes. In very few cases, it is likely that the ingrown toenail might recur. Then it again has to be addressed in the appropriate manner. It is one of the I would say inherent properties of the nail, which to some extent we are not able to address, and then there are recurrence in very few number of cases. So I think another important thing is in the post-operative period, you shouldn't wet your leg because, or probably go to swimming. You can definitely do your activities of daily living. I would suggest that you don't move around with open feet, preferably wear socks throughout the day. So what happens is the infection is taken care of since we walk over the ground. It is likely that the wound might get contaminated because of the dirt and dust. So it is better that we put in some socks till the wound is complete, even at home. And the change of dressings obviously should be as advised by your plastic surgeon. If the dressing gets wet, either externally or because of the exudation of the wound, then you should change it more frequently. If not, you can comfortably do dressings at least every second day. Probably if it is drying, you can do it every third day. So I guess that was most of the most were that were most of the common queries which patients have regarding ingrown toenail. So that's all for now. Take care. Thanks.